We've all heard the saying, knowledge is power. And what better to be knowledgeable about than your health? So, where should you turn for news and information about doctors who can help you live a happier, healthier life? Turn to us for real stories about real doctors helping real people. People like you.
Welcome to our show, your source for news and information about advancements in medical technology and the caring doctors you can turn to for help. Over the next half hour, we will introduce you to some of the most recognized names in medicine and give you insight into some leading-edge treatments that are helping people like you live a better life. Approximately 1 in 6 men will develop prostate cancer during their lifetime. Early detection and intervention has led to extremely high survival rates. With more, here is urologist and robotic surgeon, Dr. Frank Simoncini.
Well, prostate cancer in general is, unfortunately very common, especially amongst Americans. It's more common in African Americans and patients with a family history with a first or second degree relative, like a father or brother. So the incidence goes up significantly between, say, ages 40 to 50. It starts going up very significantly after age 50, for one of the most common cancers in men. My personal belief is patients between the ages of 40, if you have a first-degree relative or an African American, should start being checked for prostate cancer, and every man at age 50 at least once a year. And the reason I say that, it's a very common cancer, and there have been a lot of claims made as to prostate cancer being very slow growing and not having to worry about it, and it's really not true. It's a very individual cancer in different patients. Sometimes it's very, very aggressive. Other times not so aggressive. A lot of it depends on your age and state of health and how aggressive the actual cancer is. But it's very important to be checked once a year. The first part of my role as a urologist is making the diagnosis. Once we have a diagnosis of prostate cancer, my role really is looking at the patient's age, state of health, how aggressive the cancer is, whether they're at high risk or low risk of the cancer progressing, and basically to give them all the treatment options that are available, at least inform them on all the treatment options that are available. And one of those is just doing close watching, called watchful waiting. There's hormonal therapy, which isn't really a cure. However, it palliates cancer in older patients so they really can go on with their lives with no worry about the cancer progressing. We do offer cryosurgery to some patients, radiation therapy, and more specifically for myself would be robotic assisted radical prostatectomy. Radical prostatectomy is a procedure that's been around, became popular in the early 1980s by Dr. Pat Walsh as an open procedure. It's a very good procedure for cancer survival, and it's a very good option for patients that want one treatment, the highest chance of a long-term cure without having any problems or without having any recurrence of the cancer later in their life. The radical prostatectomy basically involves removing the entire prostate gland, seminal vesicles, and sometimes the lymph nodes in patients that are moderate to high risk of recurrence, reconstructing the bladder neck and reanastomosing that or reconnecting that with the urethra. Some of the problems with that can be higher blood loss. You can spare the nerves that are important for erections, but sometimes a little bit difficult to see in certain patients. More recently, what's become extremely popular is a robotic-assisted prostatectomy, and in those cases, we're making very small incisions. And the robot arms are maybe the size of my finger. We have a camera that magnifies everything significantly, and we're right on top of the area where we're working. So what was very difficult to see in the past becomes just a wide open field, and it's right in front of us. The robot arms have just the exact same movement as my hands, except the wrist spins around, so it actually has more movement and more mobility than my hands. So we're able to do this generally, or usually with significantly less blood loss, everything being right in front of us. It allows for easier and more accurate suturing and removal of tissue and sparing tissue that we want to spare. The benefit for the patients is, one is usually it's significantly less blood loss, much smaller incisions, so the time in the hospital becomes significantly cut down. Time for the incisions to heal is significantly cut down. A much better chance for cancer cure, removal of the entire cancer. One thing with robotic surgery, it's not just making smaller incisions, it's that having the smaller incisions, it's a lot less postoperative pain medication for the patient. They get out of the hospital usually within 1 or 2 days as opposed to being in the hospital for a week. But more importantly, afterwards, those smaller incisions heal up generally within a couple of weeks as opposed to 6 or 8 weeks before they can get back to work and start to get back to their normal lifestyle. The patients not only heal up faster, but patients that may have not even been a candidate for a big open surgery were able to offer a less invasive robotic surgery, and many of their comorbidities aren't nearly the issue they would have been in the past having major cancer surgery. So we can offer the procedures to a lot wider variety of patients that we couldn't in the past. I feel grateful to be in the middle of my practice at a time when this new technology has come around and become available. I'm able to offer my patients more options than ever before.
Reclaim